Clyde worked on Sunday morning. He worked all the time, but he always made a habit of working on Sunday morning. So I went over to his office on Sunday morning and learned that he was the associate director of the Institute of Agricultural Medicine. And the Institute of Agricultural Medicine was really started in 1955. And the idea was, we know that the occupation of farming is very hazardous and we're not really doing much about that, and we need to do something about that. So they started this institute, the first of its kind ever in the world.
We always talk about agricultural safety being the foundation, being a three-legged stool: education, enforcement, and engineering. When you think about those three aspects, education is just, we've been doing that for a long time, really trying to fund programs that help evaluate the effectiveness of education, what types of things work, what types of things actually generate the increased skills and knowledge of the hazards.
In 75, 76, USDA made this grant to each university that had an ag safety program of $20,000 to develop the program. Those people went around the state doing programs all over the state. They had a lot of good reputation.
I would leave early Monday, get back home Wednesday night, and then try and do programs within 100 miles.
But I got to thinking, it's kind of hard to reach a lot of people, just one person running around doing programs. So I began to focus more on the training of ag educators, extension people, VOAG people, Farm Bureau people to some extent, to do more training through their own positions.
Once I really got into extension safety, I saw that most people did not have a clue about human behavior or psychology, motivation theory, which is why early in my career here, I started developing interactive demonstrations because I didn't see that. There were a few of those maybe in Nebraska with Raleigh Sneeder, but I know I developed way more sophisticated things back in the late 70s, early 80s than people had ever seen. We'd have had a corn picker simulator, a scale model tractor simulator, a PTO entrapment simulator, a big manure simulator, but then I would incorporate psychology and human behavior within that presentation, and then helping people understand why they make poor decisions in terms of safety and risk-taking.
Those kinds of experiences color what you do and really enhanced your capacity to be effective in prevention as well as any kind of research work that you are engaged in.
Enforcement has always been an interesting one because, the most effective enforcement is really the persons that are right there to oversee the people doing the job, helping them understand the risks. And if you can encourage them to have a safety culture, that becomes very effective from that aspect.
I worked for a regulatory agency, kind of good cop, bad cop. Over the course of my career, I probably was involved in close to 300 fatality investigations. Everyone's situation is different, and really you need to encourage them to personalize their control strategy.
That probably is unique from others is really looking at the engineering component and what a difference that makes as agriculture transforms. A technology could have an impact on eliminating the hazard or changing the way we actually our production systems.
The new machinery now has more shields on it. The new tractors have the rollover protective structures. So those types of things, safety's come a long way in the development.
If you can design the hazard out, it's going to be very effective. And it doesn't matter whether you're an enforcement agency or an education agency, research agency, we all recognize the value of that.
So we started doing research too. That's when in the late 80s is when research dollars started to show up. And getting injury statistics was a big thing that was just getting started.
How you could make studies of how to find out about the risky places. We made like incident studies, near accidents, looked at the critical incidents that was happening on, made farmers report to us about them. So we learned about what kind of small things can lead to larger type of events.
And then getting more into behavioral things and bringing health beliefs. The theory of health beliefs was another big one that people were starting to use. Most of these people were non-agricultural people. They were more public health people.
Because I can remember when I first joined the ISASH organization, which it was called NIFS at that time. But when I first joined the organization, It was just pretty much all safety, agricultural safety.
Biggest challenge in the mid to late 1990s was that safety was over here and health was over here, and there was not a lot of interaction.
I remember thinking, this is a male-dominated group. It was as if it was only safety, men, and I guess that's to be expected because I think it kind of evolved from the ag engineering perspective. But very few nurses and few health issues that were being addressed at that time.
That has changed tremendously.
There's been evolution. There's been such change, I think, in the organization.
We started expanding and bringing in more health topics because we realized health really relates to safety and safety relates to health. And, you know, if you're not healthy, you're probably not safe. And if you're not safe, you're probably not healthy type of thing. So we realized the two really work hand in hand, and we have worked together now for 30 years.
1990 was really kind of a watershed year. We had an idea that we need to do something about creating a broader awareness of the field. So we designed what I call the agricultural medicine policy development process that involved a national, international symposium and developing criterion about what should happen. We involved legislators, and we made it to the federal level and had a joint House and Senate hearing.
Got involved with National Institute of Occupational Safety and Health when they were helping put together the Surgeon General's Conference.
It was one of the first conferences, Surgeon General's conferences, that had been called since 50 years previously when they were talking about the lead problems that we had.
So that's how unique and significant Surgeon General conferences tend to be.
Also at the same time, Marilyn Adams, a farm wife in Iowa,
standing up and talking about losing her son and a grain bin incidents that happened.
And she, of course, really helped us in that because she had a message that people would listen to.
That was just a motivating experience. Just amazing speakers that occurred that addressed many of the health and safety issues associated with the occupation of farming.
Part of that process, there's a final document that came out called Agriculture at Risk. And this really sort of fundamentally said, this is really what needs to be done, and here's a blueprint for how to do it, not only at the national level, but at the state level. And all of this just grew more national attention until we're able to develop
NISASH, the National Institute for Occupational Safety and Health.
And that program offered up a budget of like $24 million a year, and which now funds
the 11 agricultural safety and health centers across the country.
New York, Kentucky, Iowa, Minnesota, Nebraska, California, Washington, Texas, Florida, of course, Wisconsin with the Children's Health Center.
Back in 1995, 1996, we could not get funding because they said, well, these are children. Most of them are not working, so it's not occupational. So we had all this work that we felt had to be done, but no funding agency to go to. And so it was through the action plan and then getting it signed off by like 80 different organizations, including the American Medical Association, the American Farm Bureau Federation. And I think 8 of us on the committee showed up in Washington, D.C. for what we thought was a 30-minute meeting. We banged on the doors at NISASH and had a meeting with the then director, Linda Rosenstock. She said, you know, if you get the money, we will run this program for you. And it happened. So we were initially funded in 1997.
Through the late 80s and early 90s, people were talking to me about courses, developing coursework. And
it took 3 tries, but we finally got NISASH agreed to fund it. We developed the academic program, had basically 3 core courses. We had independent studies, internships, and a number of different other things that kind of fed into the degree. So through that, we developed a minor, and we have a specialization for graduate students.
But we didn't have a textbook. So I wrote the first professional reference in Ag Safety and Health in 1992.
The hospital that I was working in asked me to look into doing some rural health outreach services, and this was when we had the farm crisis going on in the late 80s. And I had the opportunity to attend the first ag medicine course at the University of Iowa under the direction of Dr. Kelly Donna.
And other people around the country and out of the country came here to take that week-long course. Then this textbook That is the second edition of that textbook that is made for people who may be teaching the course or just as a reference work.
That was a real eye-opener for me because it woke me up to the notion that, number one, as a healthcare provider, there was an awful lot about egg safety and health that I didn't know, even though I grew up in it. And I said, if I don't know this stuff growing up in it, what do healthcare providers that go from a more urban community and wind up working in a rural community have to know, and how do they go about learning?
People like Robin Tudor came here, and they got excited about what was happening and information that was gathered and went back to North Carolina and helped start their own program. The same kind of thing happened for Texas, Kentucky, Minnesota, Wisconsin, Nebraska.
The University of Kentucky was developing a course in agricultural health and safety, and it was an academic course. Then from that, we have developed two different continuing education programs. One on an emerging population in agriculture, and that's the Amish and the Mennonites or Anabaptists. And the other one was the mental health issues associated with farming.
We were able to do international work because of people coming to this course and then going back to their own country to establish similar things. And so Australia and Sweden, Turkey, it's really helped to, I guess, make this more of an international kind of an effort.
So a group of us, nurses in the state of Iowa, developed this little organization. We decided that as a group across the state, we could be much better and more effective at delivering services than if we did it individually. And that became a kind of a unique but a popular model, and soon got the attention nationally. And in 2002, we became the AgriSafe Network, and we're a national organization.
I've been primarily a researcher most of my career, but always involved to some degree in occupational medicine, seeing patients in clinic on a regular basis. Most of my research has focused on the way we looked at pesticides.
Right about the time I started in 1994, there was also a major research project called the Agricultural Health Study being conducted by the National Cancer Institute, National Institutes of Environmental Health Sciences, and others being conducted in North Carolina and Iowa. And they were following a large cohort of farmers, farm wives, and others, and looking at the long-term health effects of pesticides and other agricultural exposures.
The populations who used chemicals, 20 or 30 years ago now are starting to manifest the chronic diseases associated with pesticides.
To follow this study along the way and help communicate the results to the people on the ground who, many of whom were enrolled in this study in North Carolina.
It's usually a family that's involved in farming. So when you do work in farm health and safety, you not just know the worker, but you know the family.
The issue of safety and health on the farm for children was of primary importance to me, even though today, with the mechanization that there is in agriculture and the growth of larger farms, the labor of children, I feel, is not as critical as it was, back in the 50s or even 60s or 70s. It's lessened. However, there is still a hurdle there with farmers and farm families.
This was 1989, okay? There were no programs out there. Marilyn Adams had not yet started Farm Safety for Just Kids. We did not have the Progressive Ag Safety Days. So I organized the first national symposium, a 3-day event just to get people to talk about what are the issues. And we had 9 different perspectives. How do you see it as a parent? How do you see it as an educator? How do you see it as a physician? How do you see it as a media person or a sociologist?
Progressive Farmer Magazine wanted to start a program to promote farm safety, as they ran a series of articles in that Progressive Farmer Magazine called Our Deadly Harvest. And it was about how many families were being impacted by injuries and fatalities. And they wanted to start a farm safety program. So I was lucky enough to be one of 12 state specialists that was invited to Birmingham, Alabama. And we actually started the Progressive Agriculture Safety Day program because of Progressive Progressive Farmer magazine. That's how the word progressive comes from.
We worked obviously with the National Children's Center. I was on the task force for their guidelines, and we did a big showcase, 10 pages of editorial in the magazine on that, and worked with them also on a survey of our subscribers regarding their ideas and attitudes toward safety and children on the farm and training them and appropriate ages and all that sort of thing.
And I can tell you the first time we started talking about voluntary guidelines for children's work in agriculture, there was so much pushback. Marilyn Adams and Mary Fleming and Susan Reynolds and I sat down one day at an ISASH meeting and said, do you think we could ever develop guidelines for children's work in agriculture? Now we consider it a legacy effort that we had previously NACAT, now it's the Ag Youth Work Guidelines.
And perhaps it's one of the most intractable problem, I think, with the feeling that you need to expose your children to agriculture and farming at an early age, or they will never end up being interested in it. And there's a fear there. And
parents, they're put in these really difficult positions of having to choose between get the work done or having my kids, like in a daycare and, just all of the complex issues that I just found very intriguing.
It takes constant work by people like us to find new ways to challenge people and to doing things. So knowing that you're changing a basic human behavior that is embedded as kids grow up with this, that is changing slowly, but it's generations of change. It's not 5 or 10 years or in a year or a single program change. It's a cultural change, and culture takes generations.
There have certainly been changes in these, and they're all good. But if I've heard it once, I've heard it 1,000 times. Yeah, my uncle rolled that tractor and he didn't get hurt. The culture tales, we developed a framework of culture, cognition, conduct, and consequence that were embedded in these blended stories of real life incidents paired with intervention strategies within the stories and the story stimulation. Again, this culture, cognition, conduct, and consequence, those big frames are around everything. But the issues are evolving all the time. And one of the things I think is really great about the ag centers over the years is that they came up with this program to fund emerging issues. If you told me 10 years ago we would be talking to farmers about farmer suicide prevention, I would say that's an impossible conversation. Nobody's going to have that with you.
Mental wellness is a really important part of the agricultural scene.
And there's several projects that are ongoing now to address mental health issues and the suicide prevention in rural areas.
And we talk to our legislators frequently about how important that farm bill was, because once something is in the farm bill, farmers can talk about it, and it's huge. If people don't think policy matters, they have another strong counterexample in the 2018 Farm Bill with the mental health funding.
You can deal with so many different things because you work with animals, or you can work machinery, you can build the machine, so many aspects of health and safety, and you can deal with the interviews, you can make measurements, and there's so many different things to work with.
The thing I'm telling a new or incoming somebody into the farm safety world is don't be afraid to ask some of the old geezers what they're doing. Call people up, see what has already been done. Not that you're going to walk in the exact same steps, but you're going to tweak it to match the population that you're working with.
Those that are involved in healthcare, those that are engineers, those that are in education, that are in research, we all have our individual little pocket that we work in, but it's just like anything else that you make, all the pockets make the garment stronger,
And we have worked together now for 30 years. I-SASH has been around a long time, long before I was in farm safety. So, this goes back multi-generations. But it continues to grow. And
I think the reason that some of us have had some successes are because of the generosity of all these people that we work with.
I cannot tell you how welcoming people were in this community, and welcoming in the best way for a community of practice and a community of scholarship.
The coalition of research and science and the opportunity to connect that to the life of a farmer and farming existence, I think made it a very easy path for me to follow. Farmers work hard and long hours, and they want to spend time on what they feel matters.
He said, if you are going to come out here and tell me how to be safe and healthy on my farm, you come and walk 10 miles in my shoes first. And we need to do more walking in their shoes today.
I can't think of anything much more important in our country and our world, really, than agriculture. It's the basis of everything. Being able to help farmers seemed like, to me, one of the most worthwhile things I could do. And
I think the thing that was the driving force was always the internal feeling that I was working toward a higher goal, and that higher goal was that we were preventing fatalities and we were reducing injuries, not only among the agricultural community, but many others, and I could be saving lives.